And we are live. Delighted to welcome you. Let me go through our intro because we're so pleased with so many people who wanted to join us for today. Hi, and a warm welcome to the Healing Healthcare Authors Tour with your hosts, Dina Redinger and Sharon Weinstein. I'll be hosting today's call. We are co-authors of the book, Healing Healthcare, Evidence-Based Strategies to Mend Our Broken System. Nurses remain the backbone of healthcare, and little has been done or even studied to remedy a system that is clearly in crisis. If this is not addressed now, things will only get worse and humankind will suffer. This collaborative book is packed with solutions to the problems that plague our healthcare systems today, the problems that lead to these troubling sentiments among prospective nurses. Nurse leaders share their experiences, their thoughts, their evidence, and strategies to ensure the health of our healthcare. What you will find within these pages are actionable steps for fixing a system that is currently suffering in silence. We must, and we need your help to do so, get this book into the hands of those making the decisions. But before we start today's program, we want to acknowledge you and thank you for joining us today. We have viewers from across the globe, so please use the chat and let us know where you are from. If you see this in replay, you can still comment, and yes, we will respond. I am so pleased to introduce today's guest. Yesterday, you heard from Bern Melnick, the co-author of the chapter that we'll be returning to today. Today's guest is also from The Ohio State University. Health and wellness advocate, educator, author, associate clinical professor, and director of health promotion and wellness at The Ohio State University College of Nursing, Megan Amaya leads a team that implements wellness strategies, programs, and services for university students, faculty, staff, and the state of Ohio community, which we know is quite large. Megan is also principal investigator on multiple health and wellness research projects. President-elect for the National Consortium for Building a Healthy Academic Community and member of several university and College of Nursing committees, Megan is a certified health education specialist and board-certified health and wellness coach. Welcome to the program, Megan. We're so pleased you're here.
Thank you, Sharon. I am honored and privileged to be here with you and also very excited.
Oh, I'm thrilled. I'm thrilled. So why don't you start off by telling our viewers, why are you involved? Why did you say yes? Who brought you to this book? Tell us your why.
Yes. Well, my boss, no, just kidding.
That always works.
Well, she's the one that brought this to my attention, of course. I have worked with Bern for, we are just shy 2 months of 13 years together.
Wow.
So we have projects, programs, resources, everything you can think of for the 13 years for the Ohio State community. We have done collaboratively. She's also my mentor and has been, quite frankly, the best boss I've ever had. Presents opportunities to me such as this where we can share our story together. And I'm very passionate about health promotion, but I'm also very passionate about Ohio State. I bleed scarlet and gray. I'm a born and bred Buckeye, and I'm also very passionate and proud of the work that we've done together. So anything that can help others on their health and wellness journey, I'm all about sharing.
I'm so thrilled. So I have a question because you brought it up. What is a Buckeye wellness innovator?
Okay.
And how do innovation and well-being intersect at The Ohio State University? Because your model is well years beyond everybody else's.
Yes. And before I answer the question, Bern is a very visionary person. I'm sure you recognize that.
Absolutely.
In a audience. And so she had that vision when she came to the university to bring people together, to build that model. And actually, we have a couple different models that we use at Ohio State, but that helped us look towards the future to where we are today. So one of the programming aspects, which is truly a best practice, it has quite a bit of evidence behind it in terms of the number of years, as well as the amount. Wellness champions. And I don't know how many in the audience are familiar or have wellness champion networks, programs at their organizations. This is actually, I would kind of call it my baby, if you don't
Okay.
mind.
No, it's
So,
your baby. You birthed it. Go for it.
right. When before I started working with Burn, I worked for the city of Dublin, which is in Northwest Columbus. Perhaps some of your audience has heard of it. About 250 covered lives, and then spouse and same-sex domestic partners. So it's a pretty small organization. They might be at 300 or so today. I still live in Dublin. And I started the champion program there. And that is what the Buckeye Wellness Innovator Program is. It's a wellness champion network. When I came to Ohio State, 2011, and I started to look around. So I was just brand new with Burn, and I was learning what was going
Mhm.
on at Ohio State with the wellness initiative already. And I noticed there wasn't much. So started going on some websites and looking at some pages, and there was wellness ambassadors that I came across. I'm going to say 40 or 50 of them, names and emails listed on a web page. And I asked around, got in contact with a few of them. Basically, the program had been shelved by Human Resources several years earlier. And so I talked to Bern. I said, Bern, I'd really like to start this. I did it at the city of
Mhm.
Dublin. This is the best practice. There's a lot of research on peer support. And we went to HR and they said, absolutely. And off we went. So it took us a
Wow.
little while to get the program up and running because you got to put pieces, parts, different specifications associated with it. You need to recruit people,
Of
get
course.
stakeholder buy-in. A little bit of a budget helps with wellness champion teams. So once we were able to secure and get rolling, then we launched about a year later and had our first cohort, and we have grown. Now, I say we just got to around 700. I believe we were a little over 700 wellness champions, which is one of the largest in the country. Our wellness champion network is actually known through higher ed and also through corporate wellness. And so we have a lot of people that reach out, and we put a lot on our website
Mhm.
just because it's easier for people to go look. So anyway, we launched and we build and build and build. And we, again, around 700 of those wellness champions that are out there in departments and units, medical center, the university side of campus, that are the extension of our wellness team. And I can provide more information if you want on that one, but in essence, they're the peer network
Mhm.
for their colleagues to share wellness opportunities, role model. And we actually have our wellness champions implement activities in their respective areas. So that's
So
a
I
really
have an
good,
add-on question to that, though.
yeah,
That really intrigues
absolutely.
me. I'm assuming that one does not have to be an RN to become a
Oh,
wellness champion, that it's open to lots of people. So what are the qualifications for a wellness champion? What do you need to do or be, or
yeah.
what kind of credentials do you need?
It's pretty simple, and there's a bullet point list on our website for the audience to go check out if they like, and I can share that website a little later.
Sure.
Passionate. So passionate about health and wellness. I would imagine we don't study this, but almost all of our wellness champions do something wellness related in their personal lives. So that passion is there, that self-motivation is there, but then also passion to help people around them, their colleagues. And so that's another important, I would call, criteria of the role,
Right.
is to want to help others around them. Also, to be able to communicate. So a wellness champion has to have some communication modalities in their respective areas. Again, they're that arm of the wellness program,
Mhm.
of the strategic plan, and that criteria is a strong word there. We ask them to be that, and they have to be on board with that notion as well. So there's no real hard criteria. The only number that we would give to a wellness champion is we ask them to spend about 2 or 3 hours a month doing their wellness champion responsibilities. It's really helpful if a manager and supervisor approves that. We don't need anything in writing. We do invite the manager or supervisor to be a part of orientations and strategy sessions, but it's not required. But certainly having that manager support makes a huge difference in the wellness champions role and being able to do things in their respective areas.
So the champions are actually employees of the Ohio State University?
Yeah. Well,
Okay.
so the one that we run is faculty and staff. There is actually a student component run by the
Mhm.
Office of Student Life, and they have wellness ambassadors for the students. Ours is solely focused on faculty and staff at the university.
Okay.
Yeah.
That's exciting. That's very
Yeah.
exciting. So let's switch gears for a minute and go back to your chapter.
Mhm.
Okay. Your chapter is obviously part of the well-being section of Healing Healthcare. It fits, it's a perfect fit. Um, what would you say? There's so much content in there, there's so much relevance, there's so much message. I mean, these messages need to be shared.
Mhm.
If you had to give us one takeaway from your chapter, one thought that will lead to transformative change, what might that be? What should
One,
people know?
I know it's really hard to
Yeah,
narrow it
just
down
one.
to one for transformative, because I could go in a couple different areas here, but mm, I'm going to go with, this is a tie here, but I'm going to go with partnerships and collaborations across your organization. I like to say there is no I in wellness. There's an I in well-being, but there's not an I in wellness, if you can have a little fun with that
I
one.
get it.
Yeah.
So
And
it's we, not me. I get it. I get that concept.
absolutely.
Okay.
And small organizations have their politics, large organizations have their politics, and there can be a lot going on across that
Mhm.
continuum that I just mentioned, whether you're small or large. And things pop up, and you don't always know about someone that's doing wellness in another area. Those wellness champions are our partners and our collaborators across the institution, the organization. And whoever you can get involved in the wellness initiative, whether it's an arm's reach away or it's closer, is going to help those that are facilitating the program. I could not do my job. My team could not do its job. Byrne could not do her job without having those collaborators at the university.
Okay.
People have innovation, they have creativity, they bring new ideas to the table that our team doesn't always necessarily think about. They can help plan programs, they can sit on volunteer committees or task force or whatever it is that you're trying to work on and really help bring things to life. And that's how we view our partnerships and collaborations. Also, they help get people around them excited. So it might take a little bit of time for that excitement to build, but the more people you can get involved and have a vested interest in the
Of
wellness
course.
initiative, then it's just going to keep spreading and spreading over time and can make a huge difference. It has made a huge difference for us at Ohio State.
Okay. So you refer to your team. How many people are on your team?
So we have full-time and then we have a couple of split positions like myself
Mhm.
and two of my colleagues were 50-50 with the College of Nursing
Right.
because
Joint appointments.
Mhm. So I have four full-time team members. Three of us are part-time, and then Byrne is our leader, and she obviously is on the team too. So is that about 8 people? And then we have students that float in and out depending on the semester and practicums and internships, which is really
Yeah, I
great.
was going to say, do students get to do internships with the team? That would be really beneficial because that's creating the next cadre of
Oh
leaders
my gosh,
of
yes.
wellness. Yeah.
Yeah, absolutely. Yeah, they bring a breath of fresh air to our team every
And are
single.
those students only from the School of Nursing or are they university wide?
They're actually internal and external. So we
Oh,
partner with other institutions in Ohio, close to the Columbus area. I don't know if any of your reader or listeners have ever heard of Ohio University down in Athens, Ohio. We've had students, a part of our team from there. And then Ohio State, there's several programs that are in the health promotion space that we have those students, undergrad and graduate students, work with our team and help us with a lot of the operations, but then we also want them to contribute to ideas and programming and activities like that.
that's exciting.
Yeah.
What I find is most exciting that I've published in the past on strategic partnerships and how by building strategic partnerships with your colleagues, and I first did it, gosh, in 1992 when the former Soviet Union dissolved and we were creating the healthcare infrastructure for 11 new countries. And it was very important to partner with people like Cigna and ANA and others. I'm wondering if there is an opportunity for students in high schools as well to also participate. And the reason I ask is we know that the next generation of nurses is now in middle school. If we really want to embrace wellness and well-being as a concept and a model that we want people to adapt
Mhm,
or adopt
mhm,
for their futures and for ours,
mhm.
how soon is too soon to get started with those folks?
Oh, it's not too soon. I would say that one of the issues you run into is the children being under the age of 18, and sometimes there's policies and procedures around that depending on the organization.
Right,
I like to tout the volunteer aspect to that, so it's not obviously associated with class credits or anything a curriculum, but if a student who's under the age of 18, as long as the parent provides permission and they want to volunteer in that health promotion space, we welcome that opportunity. You just organizations need to check on those types of policies. But
right,
I know the College of Nursing at Ohio State provides opportunities in the summertime to bring middle and high school. So same with other colleges at Ohio State to expose those middle and high school students to nursing and health and wellness and other health science
right. To me,
fields.
it's never too soon to recruit.
No, no,
No,
you can go
because
as
we're
to the little ones if you really want, you know.
no,
What do you do when
seriously,
you
if
grow
they don't
up?
hear about it from us, from whom? Who's going to tell them that this is in fact a career path, that it is
Well,
something and it goes in multiple directions, right?
one of the activities that we put on is a summer, you would call it a wellness fair. A
Mhm.
lot of the audience that attends, hundreds and hundreds of families, is actually you get the little ones there, and then you have a college of nursing, a college of dentistry, a college of public health that are vendor tables, if you will, and they can share and have an interactive experience with elementary age students just to expose the students to different career paths. So yeah, you can start very
You
early
could
if
start very early and of course give them some swag so that they'll come back, right?
gotcha.
Yeah,
Yeah.
you've
Yeah,
got to
yeah.
give there has to be a hook to that. Listen, Megan, this has been so intriguing chatting with you, but like all good things, this too must come to a close. This is an invitation for our viewers to join us next week as we welcome another one of your peers to the program. Join us next week as we welcome Kathy Catrombone from Rush University School of Nursing. We're delighted to welcome her. We want to take this opportunity to thank you for sharing your input today. You are so enthusiastic
It's
about
natural
this. You
energy.
you are passionate, and it's that
That's why Bert and
passion.
I get along so well together because
Exactly.
we're pretty high energy people.
Yeah, it's high energy, it's passion. It is
Yeah, it is
very
passion.
clear that
Mhm.
you exude passion for this program and what you've done thus far
Yeah.
and what you'll continue to do in the lives that you will impact in the process. So I
Yes.
really want to thank you on behalf of Dina and myself for having
Absolutely.
you join us today. Thank you so
Thank you.
very much.
Yes.
It's been a pleasure.
Yes, me too. All right, take care.
Yeah, thank you. Hold on
Bye.
1 second while I stop our recording.
Yep.
Okay, it's been a pleasure.
Yes.